All right, let's get started. Today, we're diving deep into a role that is, without a doubt, one of the most vital in all of healthcare, but one that often comes with immense pressure and very little fanfare. We're talking about medical interpreting, and we've designed this explainer to really help sharpen your skills. So, I want you to picture this. You're in a high-stakes medical situation. The room is filled with blinking monitors, advanced technology, all sorts of life-saving equipment. But what's the single most important instrument in that room? What do you think? That's right, the interpreter. Why? Because without that clear, precise, and, human communication, none of that other equipment really matters. You are the essential link that makes real care even possible. So, here's our game plan. We're going to kick things off by talking about just how high the stakes are in your role. Then we'll get into the nuances that go way beyond just words. After that, we'll build a smart system for your vocabulary, apply it to some real-world dialogue, and finally, we'll talk about that all-important human element, empathy. All right, first things first. Let's get one thing straight right off the bat. Your job, it's not just about swapping words from one language to another. You're so much more than that. You are the bridge. You're the channel that allows understanding, diagnosis, and ultimately healing to happen. Every single decision a doctor makes, every piece of information a patient shares, it all relies on this foundation of communication. And guess what? You're the one building it. The strength of that whole structure, it comes down to your precision and your clarity. Yeah, no pressure, right? Okay, so let's build on that. This is where we really start to see the difference between a good interpreter and a great one. It's all about understanding that in medicine, the nuance of a single word can literally change everything. The difference between relief and a total disaster. Okay, take a look at this. This is where things get really serious. A patient might describe a burning feeling. Is that just simple heartburn? Or are they describing a myocardial infarction, a heart attack? They can sound so similar, but the outcomes are worlds apart. Your job is to make sure the right message gets through with zero ambiguity. And here's another perfect example. A sore throat is just a general feeling, a symptom. But strep throat, well, that's a specific bacterial infection that needs antibiotics. If you mix those up, the entire treatment plan goes off the rails. Precision isn't just a nice to have, it's the absolute standard. So, the big question is, how do we get that level of precision when we're under pressure? Well, it all starts with building a solid, smartly organized core lexicon. Think of it as your professional toolkit. Let's start with a really foundational term, anesthesia. It's not enough to just know the word. You have to get the concept, the loss of feeling because of medication, and be ready to use it in any context, whether you're talking about a huge surgery or a tiny procedure. But here's the thing, just trying to memorize a giant list of words, that's not going to cut it. The real pro move is to organize your knowledge by theme. Check this out. When you group terms into categories like symptoms, conditions, procedures, and tests, your brain can find the right word way faster when you're in the middle of an interpretation. This isn't just memorizing, it's building a mental map. Okay, now let's take those individual words off the flashcards and put them into the real world. Because, let's be honest, patients and doctors don't speak in single terms. They have conversations full of details, emotions, and hidden meanings. So here we have a pretty typical statement from a patient. On the surface, it seems pretty straightforward. But if you look closer, there are a bunch of critical layers of information packed right in there. So you see what's happening here? You have to get every single piece of that across. It's not just, oh, my back hurts. No way. It's acute pain. It's in the back. It makes them feel uncomfortable. And here's the kicker. It physically stops them from lifting their arm and looking back. If you miss any of that, the doctor's working with a blind spot. Let's try another one. This time, it's a question from a patient. And again, seems like a simple question on the surface. But what's really being said here? Your job is to capture the whole thing. Yeah, the basic question is, what kind of anesthesia? But listen closer. What you're really hearing is a deep-seated fear of feeling pain. That absolutely anything part, that's not just emphasis, it's a plea. It's a plea for reassurance. A great interpreter hears and conveys both. And that leads us perfectly into our final and maybe the most important section of all. You're not a machine. You are not a walking, talking dictionary. You are the channel for human connection. Think about this sentence from a doctor. That first part, I know, That's pure validation. Saying that the feeling is really bothersome, that's empathy. And the last part, we will see what we can give you, well, that's the promise of help. And that's your cue. Your role is to deliver that line with all the compassion the doctor intended. The patient needs to feel that empathy. If you just rattle off the words flatly, that entire human connection is gone. You're there to convey the meaning, sure, but also the tone and the humanity. So let's wrap this all up. The path to mastery in this field really comes down to these steps. First, you have to truly understand the life or death stakes. Second, master those critical nuances between terms. Third, build your lexicon strategically. Fourth, learn to interpret the full dialogue, not just the individual words. And finally, you have to convey it all with real empathy. And I want you to remember this. All that hard work you put in, the studying, the practicing, the organizing your vocabulary, it has a direct, real-world impact. It leads to better understanding, which leads to better care, and ultimately it leads to safer outcomes for the people who are really counting on you. So I'm going to leave you with this to think about. At the end of the day, a patient is placing their trust in a provider through you. Words are easy to translate. Trust, that has to be built. So the question is, how are you going to build it in your next interpretation?